Hi, in this video, I'm going to be talking about recovery after breast cancer surgery, specifically mastectomy, lumpectomy, and also sentinel lymph node or axillary dissection. Check out our other video on reconstruction to learn more about recovery after breast reconstruction. And before I go on, I want to remind you to go ahead and subscribe to our channel. So mastectomy, just to make sure everybody's on the same page, is removal of most of the breast tissue. Lumpectomy is removal of part of the breast. What we do with lumpectomy is we remove the tumor and then a normal area of tissue around it. It's very likely that you are also going to have lymph node, either sentinel node assessment or lymph node dissection. So that's the same in terms of recovery, regardless of mastectomy or lumpectomy. So first I'll talk about mastectomy, then I'll talk about lumpectomy, then I'll talk about your lymph nodes. After mastectomy, with no reconstruction, you will have a fairly straight incision across your chest. You will be sent home with a sterile dressing with instructions to keep that on for a certain number of days. Your medical team will tell you exactly how long to keep that on, and you should be given either a prescription for or actual additional supplies to be able to change your dressing. Until the area becomes more dry, you want to keep it covered. Once you go home and you're able to change the dressings, and I do want to say, seeing the mastectomy incision for the first time can be very difficult, and you may want to have somebody with you as you do that, or you may wish to be all on your own. It's normal to be scared to look at your chest wall after removal of the breast. But back to the recovery time, if you've been sent home with a drain, that is usually what we use after sentinel nodes or a mastectomy. It's a compressible little tube that goes into the surgical incision and drains any fluid that might accumulate. That may require extra care. You may need to empty the drain bulb, which is just a little squishy bulb. You may need to dump that out and put it back on when it's empty. You may need to see how much drainage is coming out before they know when to pull the drain. You may have home care nursing help you with this. If you have any problems, make sure to call your medical team. If the drain comes out before it was planned to come out, make sure you let your team know. Once you've had the dressing is able to come off, you can usually start to shower. Before that, you'll want to avoid getting the area wet. Some people keep the dressing on and they can actually tape on some plastic wrap so they can take a shower. You'll want to wait till your team tells you you can go ahead and do that, and you'll be bathing before that. And then you can begin to start some movement in your arm, your shoulder. You'll want to baby the area at first. You want to be really careful. It will feel very different. There'll be some numbness because the surgeon will cut through the nerve. So you'll be missing sensation around the area of the incision. That's normal. You may also have pain. And while most people don't need narcotics, some people do need stronger medications. Most of the time, we can manage pain with acetaminophen, or if you're in England or other parts of the world, paracetamol, or ibuprofen, or naproxen. These are non-inflammatory, non-steroidal anti-inflammatory agents. Very rarely do people need stronger pain medication. You may be sent home with a few pills to for the first couple of days, but we do try to avoid stronger pain medicine for lots of reasons, including constipation, nausea, fatigue, loss of appetite, etc. Sometimes the incision under the arm will hurt more than the mastectomy incision, and you may be sent home with a drain for the incision under the arm and with pain medicine for the incision under the arm. If the area starts to heal and it feels really tight, you may get permission to put vitamin E oil. You take a capsule and you break it open. You can put that on the incision. Some people use sesame oil or vegetable oil just to soften the area. But you'll want to make sure it's okay with the team. You don't want to do that prematurely because we don't want to introduce anything into the surgical bed until it's fully healed, which happens fairly quickly. If you notice swelling, puffiness, redness, drainage, you need to call your medical team emergently. You can often take a picture of the area and add that to your portal, so you may not have to go into the office. If you're running a fever, however, you will most likely be asked to come in and be seen. Next, I'm going to be talking about surgical recovery after a lumpectomy. Just to remind you, lumpectomy is removal of part of the breast. There are many terms for lumpectomy: partial mastectomy, or breast conserving procedures, segmentectomy, etc. We have a whole other video on lumpectomy. In terms of recovering from lumpectomy, the recovery tends to be fairly quick compared to other surgeries, but it is still surgery. It's still a procedure on your body. So give yourself time to rest, regardless of the type of surgery that you have. The lumpectomy incision is usually made horizontally, not vertically, because as it heals, it leaves a much better cosmetic result. As scars heal, they tend to pull the tissue together, and if it's done vertically, the tissue on your breast will pull your breast and distort the shape of your breast more than a horizontal incision. After lumpectomy, you will have a dressing, just as you would with a mastectomy. You'll be given instructions on how to care for it. You'll have a sterile dressing for a few days, and then once it's able to be open to air, you can usually start to shower. Again, check with your medical team. If you've had a sentinel node procedure, you may have a drain. It is uncommon to have a drain after lumpectomy, but some people have had drains. Again, it's pretty uncommon. The recovery time for your surgery, whether you've had a mastectomy, lumpectomy, with or without lymph nodes, is usually, you'll be told a couple things by your medical team. You may be told 10 days, but I generally recommend 2 to 3 weeks. And that's because your body's healing from something pretty tremendous. If you watch our fatigue video, I talk about this as well. Your body is healing. And it takes your whole body. Although the surgery is local treatment, and it's just to that area, the healing process is actually involving your entire body. And you may be more fatigued than you expected. If you can, take an extra week. If you can't, I would encourage you to go back midweek, either Wednesday or Thursday. Ease back into work or your other activities. If you've been the one driving the kids to school and somebody else has been covering for you, don't start on a Monday, start on a Wednesday or a Thursday. I've used this tip for years with my patients, and I've never regretted it. My patients have never regretted it. Frankly, when I went back to work after having my kids, I went back on a Wednesday. Smartest thing I could have done. As with mastectomy, and you may be given pain medicine for the sentinel nodes or the lumpectomy. We try to avoid strong pain medication for lots of reasons. I think I've covered most of this now. After a little while, you'll want to start moving your arm and regaining normal activity. You don't want your shoulder to become frozen. You'll want to start moving it, but wait till you get the okay from your medical team. Covered a lot in this video. I hope it's been helpful. If you want to learn more about your surgical and other treatment options, go to yerba.com for your personalized report. Follow us on Instagram. And as always, drop a comment or question below. Share your experience with the Yerba community. Thanks for watching.